Mental health is one of the hottest topics in today's era, but it wasn't always the case. A good majority from the older generations still have a hard time wrapping their heads around this idea and think it's all just mumbo jumbo and that the youngsters are just making things up. And this is causing such a big divide that it's affecting relationships both at home and in the workplace. And that's what we're going to be covering in today's episode. Hello, everybody. My name is Lakshan. I'm your host for this episode.
And I'm Goldie, and this is episode 25 of Mind the Gen Gap podcast.
So, you know what, Goldie? A few weeks back, one of my neighbors had knocked the front door of my house very erratically, and when my mom had gone to open it, she saw this girl was hyperventilating, grabbing her chest, and she was sat on the floor. Of
Oh,
course,
wow.
my mom freaked out completely, as anybody would looking at that. And this girl's house door was open, so she immediately picked her up and brought her to her house, tried to calm her down, give her water and medicines and all that stuff. And around this time, my mom, because she was freaking out, she decided to ask my brother to go down and find her husband. So he went down and to get this girl's husband, and nonchalantly I walk into the house at that point. I was not at home, and looking at what's happening, as Kavin, my brother was narrating all this stuff to me, I felt like, it doesn't look like it's like a medicine based issue.
Hmm.
The way she was reacting, it looked familiar to someone who would notice these things when a person has, say, anxiety issues or like a panic attack of sorts. And eventually they go to the doctor and they come back later at night. And once she comes back at night, she tells my mom that no, it was nothing, auntie, nothing to worry. It was just an anxiety attack. And to my surprise, my mom actually asked me from a place of curiosity, not from judgment at all, what this anxiety attack thing is, because she had heard something about a panic attack from a health expert that she follows on YouTube. So I
Oh.
explained to her this is what it is, and she was super, super understanding of it. But unfortunately, this isn't the typical experience that most people would have when they speak to their parents about issues like these because they don't really understand it.
Hmm.
They're really trying, and progress is happening, but it's a lot slower than they like it to be. But it is happening, so that's good news. Goldie, I remember again a few months back you had mentioned the story of a young girl who had moved to Barcelona for her academics, for her university, who was dealing with certain mental health issues, um, and you were kind of not mediating. You wanted
Hmm.
her to, you wanted to enable her to do what's right by herself without being dependent on you. I remember this. I would love to hear your story and your interaction with this girl.
Yeah. First of all, I don't think it's at all surprising to feel what your mum felt when there's a woman just freaking out in front of her own home. Um, and very quick thinking. She went and got a hold of the husband. Um, So the story that I want to share is somewhat similar because I experienced a very um, similar or a little bit stronger episode with a person. This girl who was here. She was doing her masters, and we got to know each other sort of vaguely through a common person. And she had my number. We were in touch on and off, just to sort of as a helping hand, as you do, as you need somebody in a new city. And she called me one day on the phone, and I obviously picked up, and she sounded a little frightened. And I said, "What's going on?" And she said, "I don't think I feel very safe in my own company right now." And it was quite late. It was about late, as in it was 7 or 8 p.m. local time here, and I was just like your mum, a little bit taken aback. But at the same time, I felt that this person needed some sort of help or company. I think that's the feeling I got. So I said, "Do you need me? Can I help in some way? How can I support you?" And she said, I don't really know, and I just feel like I don't feel safe in my own company. And she said that word over and over again. So I immediately thought, I'm not going to diagnose this on my own because I'm not a mental health expert. But what I did do was I offered to come and pick her up and take her straight to the ER because I knew there was something that didn't sound or seem. I must admit that intuitively I felt this was the right thing to do, so I went ahead and did it. If I wouldn't have intuitively felt it, perhaps I would have just tried to help her or keep her company over the phone. But a part of me was keen to go that step further. And I'm quite glad I did, because she did end up having a panic attack, and was diagnosed with what she had later on, and had a medical plan put for herself. But I think what I really liked about this whole incident later on, as I reflected on it, was her bravery and her ability to reach out to somebody over the phone, which is something that I think a lot of people have a hard time dealing with. And I think that kind of encompasses a large part of this conversation, which is, mental health. Um, and I would love you to, cover that as we move forward, Lakshan.
Yeah, what you mentioned about this bravery piece, and her having the what do you say, being in the mind space to be able to reach out to you for help, because that's how she felt it was best for her to deal with it. We're going to
Mm,
be speaking about essentially how each generation perceives and handles and deals with mental health. In this episode, we're going to be breaking it down into two segments. The first segment being, well, each generation's approach to mental health. The second one being what I call the mental health gap and how we can go about bridging it.
mm,
Let's start with the first segment because it would be weird to start with the second one. Anyway, so starting with the first segment, we have the boomers, the boomer generation. Now, their approach to mental health is you just push through. Now, this approach obviously makes sense for a generation who was brought up in an era where emotional expression of any kind really was discouraged. There is a study conducted in 2018 by the American Psychological Association that found that only 20% of baby boomers said that they were comfortable talking about mental health, and that there's another study which says that the suicide rates amongst men specifically who are in their 60s and 70s are disproportionately higher. Now, after that comes Gen X, whose approach to mental health is just deal with it yourself. Now, again, this approach makes sense given that their upbringing was so. They had to learn to be independent in every sense of the word. And they were also the very first generation to witness widespread divorce. So, having to go through that tumultuous change, they had to just put up with it and say, no, you deal with this yourself. And according to a 2021 Gallup report, Gen X were found to have the highest rates of burnout amongst all working generations. Mind you, today there are five generations at work. Out of all five, Gen X are the ones who have been reported to have the highest rates of burnout.
mm.
Also, 60% of Gen Xers report experiencing significant stress on a daily basis, yet only 1 in 4 seek professional help. That is 25%. Then, of course, we have millennials whose approach to mental health is therapy is the answer. And this is a generation that popularized mental health awareness, which is both a good thing and sometimes a not so good thing. Therapy use amongst millennials has skyrocketed by 150% between 2013 and 2023. It's increased by
Wow.
150%, yeah, in a span of the last 10 years, basically. Now, I spoke about the not so good thing, which is that they also report the highest levels of anxiety and imposter syndrome with 86%. That is close to 90%, 9 in 10 millennials basically, saying that they feel overwhelmed by work and life expectations. And then we have everybody's favorite, Gen Z, whose approach to mental health is everything is trauma. They understand mental health like like no generation before them, but sometimes it's almost too much. Every little inconvenience is labeled as a trauma response. And I know, Goldie, you've heard plenty of, you know many instances where people talk about every little thing as a trauma response. While that may be the case, you kind of also have to deal with it, right? And 91% of Gen Z say that they've experienced some level of stress or anxiety, and that and that they are 25% more likely to be diagnosed with a mental health condition compared to millennials when they were at the same age. What's ironic is that while they are the most mental health aware generation out of all generations so far, they also struggle the most with implementing solutions. Hence, the whole every little thing is a trauma response. It gets blown out of proportion is what I believe.
Mm.
Goldie, what are you noticing about all these various approaches to mental health?
Well, starting with the very last one, the biggest paradox of their lives, I think, quite neatly describes Gen Z. But we'll come back to them. I think all in all, what I'm observing is it's not a myth that mental health has grown to become a reality. Mm, And it is true that it's always been there. I'm not denying it. And maybe it was not addressed so openly, maybe for the boomers. Progressively, as we've moved on, things have become a little bit more transparent and spoken about. But what hasn't changed, and that's why I come to Gen Z now. Yes, they are the most aware generation when it comes to this topic, and kudos to them because they obviously know what's going on. But what remains the same is what is a teenager, and I just want to talk a little bit about that, which is that there's always this fear of judgment, whether you're 13, 14 today, or whether you were 13, 14 in 1991. uh, the complexities of what's going on in the teenager brain remain exactly the same. Now, in that light and that spirit, what's changed between 1991 and 2025 is that they have the same fear of judgment, but there is so much more exposure to that judgment now because of our famous
Correct.
friend, social media, advanced in technology, um, and all these words that you've mentioned, imposter syndrome. Where does that come from? I mean, that vocabulary, I don't think was at any point in my dictionary of words when I was growing up. But did it exist? Of course it existed. We also felt imposter syndrome growing up. Now that I think about it, I've got examples, but was it so vocalized? No, it wasn't. Now today the difference is, not only is it vocalized, not only is it spoken about more, which is great, the education is available, you can understand what's going on with you, but you also feel like, and I want to say something very controversial now, you need to be a part of the talk. Because if you don't have something, then
Right.
maybe you're not, being the conventional Gen Z. And I'm not
Yeah.
saying that it's not valid. Yes, there are a lot of kids, suffering, and my heart goes out to them, given the example that I shared at the very beginning. But there is also this overhype on, oh, but maybe I have this because I read about it on Instagram, identifying with something that's not really what's going on with you. And that's where I blame these so-called therapists. Everybody's a therapist, apparently, you know,
Yeah, a TikTok therapist,
a
mind you.
TikTok therapist. Exactly. Or phrases like, I'm just expressing my feelings. I have every right to do that. Yes, of course you have every right to express your feelings, but not at the cost of getting away with crossing boundaries with people or having relationships that could be damaged because you're claiming to be, hurt by the consequence of somebody doing something to you, which is just very simple, isn't it? Where do you put your boundaries? So there's a whole conversation behind this. I also think that Gen Z have it harder in other ways in terms of, competitive jobs that we didn't have back then. So there is a lot more stress on them, 100% more academic pressure than what we had back then. We had the pressure, but there is a higher pressure now because of the competitive nature of what the world has become. I also feel that they carry with themselves this whole idea of the world not being as it should ideally be because of things like climate change. And they do carry those pressures on them. So, irrespective of the teenager that you had then and now, there's layers that have added on in 2025. Okay. um and I think that the big word that they don't have as much of that we did was resilience. And I think resilience is a muscle for me. Always, you need to really exercise it, right? um the irony is that they actually know that their older counterparts, have weathered similar challenges over time, but the fact is that they don't have the same levels of resilience in them to face those challenges as stoically as maybe a Gen X or a boomer may have faced. So even that is a layer of inadequacy that they have, and that brings a whole other emotion, which is shame, which is why they don't face the reality, and
Correct.
they try to self-diagnose. And of course they can, right? Because today even AI has therapists. So there's a wheel that's turning constantly, and it can turn into a hamster's wheel, unfortunately, if not addressed at the right time.
Yeah. Yeah, and I agree with you on it's like if you don't have something, you don't belong in the club, right? It's like you're not one of the cool kids, so to say.
Yeah.
That I suppose that need to, of course, when you're younger, the need you have to, the need to belong is a lot more, in the sense that you're willing to do whatever you can, compromise if you have to
Mm,
to fit in, so to say, right? I think you only really start to embrace yourself more as you get older, or more than older, like wiser, let's say. You experience more things in life, and that's been the case for everybody throughout history. It's just a different experience for Gen Z and now for Gen Alpha as well, right?
yeah.
And what you mentioned about the resilience piece brings us very seamlessly, I would say, to the
Mm,
next second segment of this episode, which is on the mental health gap, as I call it, right? Now, obviously, we all know that there is a gap in understanding of mental health across the generations. But what we don't know is the types of gaps that can exist. For this episode, I've just noted down three potential gaps. I'll just go through them one by one. The first one is what I call the stigma gap. Now, older generations, they grew up in a time when mental health struggles were seen as a weakness, something to be hidden. Therapy was for people who were crazy. And
mm,
yes, they actually said that.
mm,
Now, therapy is for them seen as a privilege or a luxury, while the youngsters see it as a necessity. This is something that you cannot do without, right? And while in the case of the older generations, it makes them more resilient, as you mentioned, Goli,
mm.
they also don't understand how their ignorance to all this mental health stuff contributes to generational trauma.
Yeah.
And then we have the second gap, which I call the accessibility gap. Now, not every generation has the same access to mental health care. Therapy wasn't always affordable, available, or even considered like a legitimate solution.
Mm,
I remember speaking to this um, 43-year-old or something, a Gen X basically, who mentioned that when I was younger, we didn't have mental health days. We had suck it up and go to work days. And older generations, they often couldn't afford or even find mental health care, so they never developed the habit of using it.
mm.
And therapy wasn't even like covered by insurance until like the 1990s or something. Now, this made them more independent, as we covered previously, but this emotional suppression or isolation, it starts to show up later in life. As I'm sure, Goldie, you've noticed, it shows up later, and you can see how
Yeah.
it plays a role in various other areas of their lives as well. And then there's a third gap, which I call the you're too soft versus you're too numb gap. Now,
Mm,
boomers often think that younger generations are too soft. Younger generations think that boomers are emotionally repressed. And 68% of boomers, mind you, believe younger generations need to develop tougher skin. And 89% of Gen Z, which is again 9 out of 10 people, believe that boomers are so emotionally disconnected. And classic Gen X, they're stuck in the middle as they tend to be in most things. They're understanding both perspectives, but they're still figuring out their own mental health situation. Ironically, older generations call the younger ones soft for seeking therapy, while they're out there experiencing heart attacks because they refuse to stress less. It's super ironic to me, Goldie. Again, I covered some of these gaps as we spoke about regarding how we view mental health. What do you feel we can do to bridge these gaps? I have a couple of ideas. I'll talk about them
Mm.
probably later, but I'd like to hear from you first.
What's really just so obvious as you speak about the manifestation of the stress, one being in a physical form, whether it's through a heart attack, or how many times have we heard, boomers complain of a bad back or aches and pains, uh, versus a Gen Z or, even X, I would say even millennials, they feel it more in their minds. They have anxiety or panic attacks, but the result is all coming from the same place: mental health. Where if you choose to suppress it, it's going to manifest in some way or the other in your body. If you choose to vocally speak about it, it's also going to manifest if you don't address it through a panic attack. So it's not something that anyone can really escape. I'm seeing here. And when we talk about bridging the gap, well, to be fair, because I'm an X, and as you were speaking about the distinctions between a Gen Z and a boomer, the first thing that came to my mind was, can we just get into the same room and talk about it? But that's a classic X response, right? I also feel that all jokes aside, what has always been the fundamental solution to most things is social connection. So if you are born and raised in a family where you have access to elder members, and it's the same for elder members, access to younger members, I think that needs to be cultivated far more than it ever has. It used to be a thing, right? It used to be a thing where on the weekends you would go and meet your grandparents and have lunch
Yeah.
with them. At least in Spain, this has always been a very cultural thing to do on the weekends. You have family lunch and everybody gets together and they talk and they chat. And I'm not saying it's because everyone's got mental health issues. It's just healthier. It's a prevention because you get perspectives. You can hear the narrative of your grandfather. The grandfather hears the narrative of the grandchild. And these are all, who are they? They're different cohorts coming together. That's one solution that I'm suggesting. Obviously, every cohort has their own way of coping, whether it's doing a regular exercise pattern or whether it's meditation or whether it's just journaling. I mean, these are all preventions, aren't they, that we have today. We can also access all that on YouTube and TikTok. It's a real thing. But it doesn't mean that one recipe suits every single individual. It's such a personal choice and what works for you.
Yeah. It's not a cookie cutter approach as we call it, no? Yeah.
No. Yeah.
I love that point of connection. Anytime I hear anything about any form of connection, it immediately takes me back to that Harvard study, of longevity,
Yeah.
of how the solution to anything to do with longevity is like connection, right? So
Exactly.
yeah,
Yeah.
and what you said about uh, a classic X response of, well, just get into a room and speak about it. That would be like a solution that I also would propose, because genuinely I think that when you really break this whole mental health thing down
Mm.
into what is required, I think what is required most is a form of balance in how we deal with it,
Yeah.
right? Picking up things from each generation and seeing, okay, what worked for them, what worked for them, what is too much, what is too little,
Mm.
and find an amalgamation that works for you as an individual, is what I believe. And the only way to do that, of course, as you said, is to have conversations and really connect, right? And I think that's the point of this whole episode. Because we talk about how mental health is a very real thing and that it matters very much. And like I said, the way we deal with it needs balance. I truly believe that the first thing we need to do is to understand what makes each generation view mental health the way that they do. Then we need to see what can we learn from each other's approaches to dealing with it. For example, from the older generations, boomers especially, we can learn how to be resilient and really push through no matter
Yeah.
what comes our way. From Gen X, it would be learning to be independent and not immediately running behind people or resources or coping to deal with what you're facing all the time, right? With From millennials, I think we can learn how to open up and ask for help. And with Gen Z, I think we can learn how to have very open conversations. I think a lot of topics that were once considered taboo to speak about openly are not so taboo. And I think mental health, again, is one of those things that is no longer as taboo. And it's something we can learn from Gen Z. And lastly, I think we need to validate each other's experiences and learn to speak
Yeah.
each other's language. And
Absolutely.
yeah,
Absolutely. I'm
because there is
sorry.
this no,
Yeah.
yeah,
I don't know. I just have this compelling feeling to say that at the end of the day, the problem is the same.
yeah,
It's, and it's just that everyone's solution could be a different one, but the journey is, sorry, the destination is the same, but the journey just may differ. And I think, again, coming back to Gen Z, yes, you're right. We are learning so much about mental health from them because they are having these open conversations. But the problem there is that they are sometimes getting sucked into a conversation which they are picking up either from TikTok or from some sort of experience that their friend has shared, distorted information often, and so that is what leads them to become this the snowflake generation, I think, which we've obviously mentioned in the past. But that's not their fault. It's because of this uh, excess access to information, which is just clouding their minds into actually deliberating what is really a problem, and could honestly be a mental health issue, or what could just be solved by having a chat with your grandfather
yeah,
and him or her telling you, you know, we did things this way. Would you like to try it? But for that, you need the boomer to be non-judgmental towards, firstly, their own child, which is most definitely a Gen X. And then the Gen X is able to communicate that through to the Gen Z as well. So it's a bit of a ladder we're climbing, but we must remember that you can't just keep climbing. You may have to come down the ladder sometimes.
yeah. This excess access bit that you mentioned, no, um, like I think it's important to especially to inform Gen Z or help them realize that defining and identifying yourself based on your struggles is not a strength.
No,
Just the same way that they believe that talking about mental health is not a weakness, this also is not a strength. And as you said
no,
about the ladder, you have to meet somewhere in the middle,
halfway.
right?
Yeah,
The answer is somewhere in between only, yeah. And
exactly.
because at the end of the day, mental health isn't about generations; it's about people. And when you realize that, that's when you have successfully actually learned to mind the gen gap. Obviously, Goldie and I believe that this topic needs a lot more awareness.
Yeah.
And if you believe the same as well, please do share this episode with people who you feel like they should really, really learn about this and know about this. And please subscribe to us if you haven't already. It really, really helps us push this message and all the other messages that we have more. And with that, we come to the end of episode 25 of Mind the Gen Gap podcast. I've been your host, Lakshan.
And I've been your co-host, Goldie.
Thank you so much for listening, watching, and tuning in all the way to the very end.
Muchas gracias.
See you in the next one.
Hasta pronto.
Bye.